corrections are forgotten. I think when you look at the bigger, broader criminal justice, the police, the courts, is what we see on TV, but we don't see a lot of awareness around correctional officers, and they're vital because they keep communities safe. Before I retired, I was fortunate where I was able to get my doctorate degree, so it allowed me to safely transition from the corrections into academia. So a lot of the work I do now is restorative, trauma-informed training. My name is Dr. John Watts. I am currently a professor and program director at the University of St. Joseph in West Hartford, Connecticut. But more importantly, I want to give back to the field by training, staff development, professional development, things of that nature, things that I've missed out on throughout my career. So back in 2002, I began working in corrections. In 2005, I transferred to or transitioned to community correction, where I was a probation officer. I worked in the inner city, and throughout my career, I had an opportunity to supervise so many different caseloads and populations and things of that nature. And sadly, I think with the population trends that we're seeing, correctional officers are really not equipped to deal with all of the different nuances with the different populations that they're seeing, mental health, substance abuse, and now we demand correctional officers to wear so many different hats, to deal with these different unique populations. So I think we need to do more to train and enhance our correctional officers, because they're tasked with just managing so many different facets of society. Corrections right now is currently facing a national crisis because staffing and turnover and wellness, and sadly, a silent killer is suicide rates are raising or increasing dramatically for correctional officers. Working in corrections and protecting us behind the scenes, oftentimes, the workforce, it can affect the general public. In correctional officers, as much as people think they still can intervene, they can coach, they can do a lot of things to prepare individuals to go back out in society. So if we don't have our correctional officers fully staffed and working at 100%, and investing in having those interventions with inmates, public safety can be compromised down the line. So we have to make that investment, especially in funding our correctional facilities, but also staff development. Let's give our staff support, that they're excited about going into work, making change. And I didn't realize that me not working at 100% compromises public safety. We are so behind the scenes, but if we are not working at our best, it trickles down out to the public, So when I had that conversation with my regional managers, who really connected my lack of effort to public safety, because that always have to be the primary goal and the mission. But I also thought about how many other of my colleagues are also suffering in silence, wellness and compassion fatigue and burnout. So once I went back to school, I got my doctorate. One of the things that I'm really passionate about now is training that correctional staff of what compassion fatigue looks like, what burnout looks like, and also vicarious trauma. There's different definitions, and I think we just all throw it in one pot, but there's different things, And if I had the definitions for my career, I would have been better situated with seeing the symptoms. What are interventions that we can do now before it gets worse? So I think it's important, and that's one of the things that I'm passionate about on the other side of my career, is how do I go back into the workforce and really educate and have these difficult conversations. We have to do more, but it started with me going through and having an appreciation of what these things look like and wellness looks like.